You're listening to The Social Workers on WCDB Albany.
And welcome back. You are listening to WCDB Albany. This is the Social Workers live radio talk show. My name is Eric Hardiman. I'm your co-host, and I'm here with my co-host, Alyssa Lotmore. Welcome back, Alyssa.
Hi, Eric. We have a really exciting show today. Today we're going to talk about the Long-Term Care Ombudsman Program. So for those listening, have you ever wondered what an ombudsman is or how they help people living in nursing homes? Today we have two representatives from the Ombudsman Program who are going to speak a little bit more about the program, what it does, how it helps people, and how you can volunteer.
So we have two special guests on. I just want to make sure real quick technically that we can hear you. Mark and Catherine, are you there?
We're there.
Great.
Good morning.
Great. We can hear you loud and clear. Perfect. So on the phone, we have a special interview today with Mark Miller and Catherine Horan from the Long-Term Care Ombudsman Office here at the New York State Office for the Aging in Albany. Mark Miller has been involved in the field of aging and long-term care since 1984, when he first established a local ombudsman program in Charlottesville, Virginia. He worked with the Virginia State Program for 13 years, serving as state ombudsman for more than 8 years. During his tenure, Mr. Miller was instrumental in the establishment of the Virginia Elder Rights Coalition to promote coordinated advocacy assistance to older long-term care consumers and their families. In 2000, he joined the National Association of State Units on Aging as a senior program assistant for elder rights, coordinating the efforts in support of the National Ombudsman Resource Center. He also served as NASUA's representative on the Center for Excellence in Assisted Living Advisory Council. In February 2008, Mr. Miller joined the New York State Office for the Aging as the State Long-Term Care Ombudsman. He has worked to strengthen the program's capacity to help improve and protect the health, safety, and rights of residents of long-term facilities across New York State. This is done through education, empowerment, and advocacy services. Mr. Miller also serves on the Board of Directors of the National Association of State Long-Term Care Ombudsman Programs. Secondly, we have Catherine Horan with us on the telephone. Catherine is the program director for the Long-Term Care Ombudsman Program in the Capital District, administered by Catholic Charities Senior and Caregiver Support Services. Previous to this role, she worked at Catholic Charities as program manager for the Aging Services Program, HICAP, and Nutrition Outreach Education programs. These programs assist seniors to connect to resources and benefits that increase the quality of their life, provide health insurance counseling, and assistance in obtaining benefits. Catherine earned her bachelor's in social work from Siena College and her master's degree in social work right here from the University at Albany. So welcome both Mark and Catherine. We're very excited to have you on the show today.
Thank you.
Thank you.
Morning.
Very, very impressive bios, and I'm so glad to have an alum on the show as well.
Thank you.
So let's just sort of jump right in, because as we've been preparing for this show, I've been learning a little bit more about the Ombudsman Program. But can you tell us, tell our listeners, what is the Long-Term Care Ombudsman Program?
Sure. Good morning, and thanks for having us on. The Ombudsman Program quite simply, is serves as an advocate and resource for individuals that are living in long-term care facilities, nursing homes, assisted living, and other types of adult care facilities. And the primary responsibility is to help residents and families understand and exercise their rights and effectively address concerns that they have that might be impacting their health or safety or their quality of life. We advocate for folks both at a individual and systems level. The primary responsibility of the Ombudsman Program is to receive, investigate, and resolve concerns that people are having in facilities. But we're also there to provide systems or issues advocacy, and we promote the development of resident councils, for instance, so residents have a greater voice in their life at the facility. And we also provide information to the general public and to other government agencies about those concerns that are impacting long-term care consumers across the state.
I mean, this seems like such a critical program, a much-needed program for individuals. Now, I understand the program has recently undergone some changes to improve its advocacy, and can you tell us a little bit about that?
Right, thank you. So we have previously operated with roughly 30 programs, local programs around the state that would recruit and train volunteers to then go into facilities and help residents. Unfortunately, with resource limitations, oftentimes those programs could not provide a full-time coordinator to do some of those activities. So we stepped back and we looked at how the program was organized and how we might be able to revitalize the service. And so we went to a regional approach. So now we have 15 regional ombudsman programs across the state. And quite frankly, it provides us some additional economy of scale. So I think in the long term, we're going to have improved advocacy services to residents, greater consistency of the service that we provide and the training that we provide to volunteers. Partly because of the enhanced economy of scale, we now have more full-time paid staff that will be working with these volunteers and addressing some of these issues. So, and perhaps most importantly, it's improved our capacity to maintain our high-value resource of nearly 1,000 volunteers across the state. Because the volunteers really are the lifeblood of the program. They're the persons that are actually in facilities working with residents.
Well, yeah, I mean, that's really great that the program's growing and they're able to hire more of the full-time employees. With that, though, is there a cost for the service as you're growing? Is there a cost for those who want to utilize the service?
Nope, there's never a cost for ombudsman service. It's totally free.
Wow.
And how does this, Mark, I know you've done a lot of work, as we read in your bio, a lot of work nationally. How does what New York State is doing in this area, how does it fit nationally with what other states might be doing?
Actually, that's a good question, Eric. I think New York is actually leading the way in some regards. We've now that we've gone to this regional approach and how we use volunteers, I believe we have more volunteers than any other state at this point. So part of that is, the dependent on volunteers because of, limited resources. But other states are starting to actually contact New York to ask about how we accomplished going to the regional model and how we use our volunteers and the training that we provide them.
Yeah, because I would imagine, anytime you've got a volunteer workforce that's big, you've also got issues of retention and issues of training and sort of how to keep volunteers engaged in the work. Actually,
it's that's one of our biggest challenges. And the turnover rate, can be relatively high. And so we're always, and I know Catherine's going to talk about this, because we're always looking for bringing in new volunteers.
Great.
And, you spoke so much about the benefits of this program, and it seems like it to be a real asset to the state and to each of our, local communities. But are there any types of complaints that the program receives, and who makes those complaints?
The majority of our complaints come from folks that are in nursing homes, and unlike the rest of the states, most of our complaints come directly from residents, and that's partly because we take a very proactive stance. We're in facilities routinely. Volunteers get to know residents, and then they feel comfortable with approaching them with their concerns. So the majority of the complaints that we're receiving are coming directly from residents. The sort of issues that we're dealing with in nursing homes, it's primarily quality of care issues. In adult care facilities, assisted living, more quality of life issues. Those are folks that are slightly more active and able to represent themselves, and so the issues are a little bit different. In nursing homes, the top issues right now over the past couple of years have been discharge issues, and that may involve anything from planning to the notice to the actual process. And one of the issues that's just been traditionally or historically a big issue is lack of response to call bells, or the amount of time it takes to get assistance. Whereas in adult homes, the issues we're dealing with are more, I'd say, the quality of life. They're food-related issues. They're building issues, that sort of thing.
Well, I think it's sort of, I mean, there are some complaints, but it seems like the individuals, the residents, feel so more comfortable talking to these volunteers that you sort of get more information, more feedback because they have someone that they can talk to about it. Whereas without the volunteers there, they might not have had a person to talk to about issues that are bothering them. So it seems like it's sort of you're getting some complaints, but it's a positive way to get that feedback because it means people are building relationships and feel able to talk to someone else. Is that accurate in me saying that?
Right, and I think the sooner we can address an issue, the easier it is for us to resolve it. And we resolve about 80% of all the complaints that are brought to our attention.
And that's amazing. Wow.
It's a pretty high resolution rate. We're very proud of that. The other thing I would say is when we look at our program, and again there are some resource limitations, but our tagline has always been educating, empowering, and advocating. And really a lot of what volunteers do on a day-to-day basis isn't investigate complaints, but provide information to people about their rights and help them navigate the long-term care system, because most people don't plan ahead for this.
Yeah.
And then we want to empower them so that when an issue does come up, they feel comfortable trying to advocate for themselves. But of course, there's always those issues where either they've tried and it hasn't worked out, or for whatever reason, they might feel a little uncomfortable trying to address an issue themselves,
Sure.
so they're working through the program.
And this is a population that, in general, for those listeners who are thinking about the population of folks in long-term care settings, that in social work we might call a vulnerable population. I mean, a population not always able or, not always having the resources to advocate for themselves. And I think that's why a program like yours is so important.
Correct. Yeah, there's a lot of folks that I think the sense of potential retaliation is a very real fear for many people. Because at the end of the day, if you complain, it's not like you can walk away. That's your home. And so oftentimes people are a little fearful, which is why on our kind of systems advocacy work, trying to promote resident council development is a great way for folks. There's safety in numbers and to bring items of concern or areas of concern to the administration of a facility as a group voice, and I think that makes it a little bit easier.
Yeah, definitely that feeling of safety and coming together as a group. But are there any? Do you see any trends in the complaints or in long-term care in general?
Well, I believe that the issues that ombudsmen are dealing with now, particularly in nursing homes, are becoming much more complex. It's no longer the cold coffee issues. We're dealing with issues, involving discharge, involving serious resident care issues, involving the use of antipsychotic medications, and so the issues seem much more complex and serious than they have been in the past. There's also, I've noticed, a slight melding of the types of issues that we're dealing with in both nursing home settings and assisted living settings. And I think there's become more of an overlap in those populations. People always talk about aging in place. That's a big term in the aging.
Yeah.
And it sounds great, but in reality, if you've been living in a facility for a long time and your care needs have gradually increased, you're not interested in leaving. You really want to stay where you are. You're probably comfortable with the staff. They know you and you know them. And so that idea of having to move out to a higher level or a different level of care is oftentimes difficult. So as those people remain in their original settings, oftentimes the issues, I think, become similar to what you would see in, say, a nursing home.
Yeah, that makes complete sense. And I want to just switch a little bit to Catherine, because you have that more of that role of that regional ombudsman. So you have probably a little different take and give us a little bit different experience from how you see it. So can you talk about the role that you play as a regional ombudsman?
Sure. So we administer the program locally. So Catholic Charities coordinates the program for 10 counties in the capital region and on the outskirts. And the difference is we work directly with the residents, we work directly with facilities, and of course the volunteers. We do a lot of volunteer support, whether that's training or actually working with individuals directly on an issue that they are working with a facility on.
I mean, both you and Mark have mentioned volunteers several times, and I think it seems like a critical role in your program. How important is the volunteers to your work that you do?
They're definitely vital to the work. We're successful because of the volunteers. We have 2.5 staff coordinating the program for over 100 facilities within the 10 counties. So the volunteers are the ones that actually have the weekly presence and the strong presence in the facilities, and they're the ones that are building the important relationships with the residents. Because as I go into the facilities quarterly, certainly people may get to know me, but if I was there on a weekly basis, they're more likely to build trust and understand the role better. So they're more likely to talk with people about the volunteers about their concerns and really trust that it's possible that they could get some resolution.
Sure. So what does a typical visit look like when a volunteer maybe goes out, an ombudsman volunteer?
Sure. I mean, the facilities all look very different, so of course the visits vary depending on that, and plus the volunteers definitely bring a personal touch to it. But the volunteers commit 2 to 4 hours a week going to their facilities, and they'll visit with residents and really see how people are doing. There might be a lot of one-on-one visits, and it's a lot of listening. They spend a lot of time saying how you're doing and really listening to residents for quite a while. To see, understanding what their needs are and concerns that they have, whether it's about their care or the quality of life in their residence. And then, as Mark said, we empower residents to speak up, and that might just be helping them understand the different staff roles within the facility. We had someone who was saying that they have cold oatmeal every day, and he keeps complaining to the CNA, but really we just helped him to understand that he needs to talk to the head person in the kitchen about it. He's already tried with the first 2 people, and so it's time to talk to the director of food services.
Sure.
And really, he just didn't understand that there was an additional person he could talk with. So it's nice that he's able to work on that himself, and it was just some education about how the nursing home has staff and who's in charge and how to try to go to a higher level.
Yeah. So and this may be a challenging question, but is there ever pushback from the facilities? I mean, do the volunteers ever encounter sort of resistance to their visits?
Sure. And actually that's a big piece of the relationship building as well. We're definitely all about the residents, but the relationship building with the staff is an important piece of it as well. So the more time an ombudsman spends at a facility, the more that the staff are able to see that the ombudsman is there to help both sides. And when a resident is happier, then ultimately the facility and the staff are happier as well. And so that can take some time as well. We have facilities that love us, and we have facilities that still struggle with our role. So it definitely depends on the facility. It depends a lot on leadership, how they view the Ombudsman Program. Yeah. But I would say that's always improving in regards to working with residents and then working positively with the staff members.
Yeah, no, I spent some time going in a local nursing home that's right by my house. What makes an ombudsman different than someone like me who might be just sort of like a friendly visitor who comes in and says hi to individuals? What separates that role?
That's a great question. I think there's a lot of confusion about the difference between an ombudsman and a friendly visitor. And the ombudsman has a stronger role than a friendly visitor. So as Mark said, this is a federally mandated program, and it comes with a 36-hour certification training. So our volunteers get extensive training to learn about not only their role, but about resident rights and advocating so that they have the tools to go to a higher level and work with staff. They also have a higher level of access. So they're able to access records of the residents, and they work directly with frontline staff and even leadership staff, whether it's working with the administrator or directors of nursing. And that could be personal resident issues, but it could also be on systemic issues. like as Mark was saying about the call lights, the time being too long, that we would consider that a systemic issue. Or if there might be an issue about staff attitudes, as we're hearing from several residents complaining about that, those are system issues, so it would go from a higher level.
Yeah.
And the responsibility is so important that the ombudsman actually has to follow strict guidelines to be sure residents don't confuse them with friendly visitors. So we really try to stay within our role so that residents can understand the difference.
Sure. And demographically, what do your volunteers look like? Are they younger folks? Are they sort of later in life themselves and sort of more on the peer level with residents? Or what's the age range?
We have a range of volunteers, but I would say a majority of our volunteers are retirees. I wouldn't say we go as young. I think our youngest volunteer is probably 35, and our oldest is almost 90. So there is a big range of age with the volunteers. A lot of people are retired or work part-time. We have retired teachers, nurses, state workers, insurance agents. Some people are actually retired from working in nursing homes or assisted living, so they're somewhat familiar with the facilities. But we definitely have working adults, whether they work in administrative roles. We have two different artists that work independently or self-employed, and then during their free time they volunteer with the program.
And that's a wide range of different career paths that people have come from. So you don't need experience working with seniors or in nursing homes to be able to volunteer to be in this program?
No, definitely not. We have the 36-hour certification training definitely covers a lot of material, and so it helps to bring some of the experience people will need in education. Certainly working with seniors helps, or having personal connection with senior. We have a lot of people that became interested in the program because they had a loved one in a nursing home. And so whether that person has passed on or they'd like to volunteer in a different nursing home, there does tend to be a personal connection that they start to learn about the program and see a need. We have a lot of volunteers that were personally helped by an ombudsman first, and then really, really felt that the program had a lot of value and that they could bring value to more families or residents.
Yeah, definitely. And you mentioned the training a few times. What do they cover at the training? I mean, it seems like it's 36 hours. It seems like it is a lot of information. What are some of the things, the topics that they cover in this training?
Sure. It's definitely an extensive training, and we cover different things. We learn about a lot of information about residents' rights, the Department of Health process, what their role is in oversight of the nursing homes and assisted living. We work on advocating skills, cultural competency, and we spend a lot of time on complaint investigation to really understand what the next steps are when somebody does bring a complaint, whether it seems on the smaller side or it can be a very serious complaint.
And it's definitely something that they need to know. And it seems like it's important information to know, not only for a volunteer, but also people who might have individuals that are going through this experience themselves. I mean, it seems like, is there a way to access information or for people to find out more about this aside from going through the training? Is there a way that individuals who might be interested or want to know more about this program, is there a certain place that they can go to find out this information?
Sure. There's several ways you can access the program. You can go to our website, which is www.ltcombudsman.ny.gov. And you can click on Who's My Ombudsman, and it'll take you to a list of the counties, and you just there can find the number to call your regional ombudsman. Or you can also dial our toll-free line, which is 1-855-582-6769. The other thing, if you're in a facility, you have a relative that's in a facility, by law they must post information about how to contact the Ombudsman Program. And so the number for the regional ombudsman, in this case, Catherine's number should be listed there.
I mean, it just seems like such a critical program and a critical component for individuals who are in these facilities, in these nursing homes and assisted living places. So I'm really glad that there's a resource for them. And for the volunteers, I mean, it seems like it could be pretty taxing to sort of go through this process with somebody and build all these connections and relationships. What types of supports are there for them?
That's a great question. We provide monthly meetings, and some of that will include in-service training, and some of it will include just general support, where we're working with the group to try to solve a complicated issue or even patterns that we're starting to see. And then with the staff that we have coordinating the program, we do one-on-one check-ins with people. And again, that could just be seeing how they're doing, or it could be really helping to work through specific issues, whether it's guiding them or even going to the facilities with the person to work on a complaint or an issue that needs resolution. So we definitely get to know our volunteers on an individual basis and work with them, especially as they're new to the program. We spend even more time.
So if you've just tuned in, you're listening to a live interview with Mark Miller and Catherine Horan, both from the Long-Term Care Ombudsman Program here in New York State. And just a quick question, possibly for you, Mark. You mentioned sort of New York State possibly being one of the leading states in this area. Where do you see current issues going, sort of future issues, maybe I should say? What are the pieces of ombudsman work and advocacy work that are not being addressed yet? And maybe, where do you see this headed in the near future?
Well, I appreciate that question. I think at the state level, we're certainly going to be looking more at systems advocacy work and addressing some issues that we've seen patterns. And for instance, one of the things that we believe needs to be addressed, we've heard from many residents about the personal needs allowance that residents receive in nursing facilities. So if your care is being provided through Medicaid, you receive a very small amount of money, $50 a month,
right?
For personal, your personal needs. If you want to buy shoes or socks or whatever, get your hair done. $50 doesn't go a long way anymore, and it's been at that level for about 30 years. So that's an issue that needs to be looked at to determine how best to address that and make sure that people have some resources to provide for their personal needs. The other issue that comes up with some frequency is staffing. There are probably about 35 states now that have some type of staffing ratio requirement, either number of aides per bed per resident, or number of hours per day of care provided. And so those, I think, are two areas that we'll begin to look at. There's no easy solutions to those because they also require a certain amount of resources, but they are critical to providing the care that's needed for these residents.
Well, it sounds like incredibly important work that you're doing, and certainly looking toward the future is an important piece of that. We want to thank you for being our guest today. It's been a really enlightening conversation for us, and we hope that our listeners have enjoyed learning about the Ombudsman Program as well.
Well, I think it's just such a really great program. And I just, Mark, I know you already had said it, but I really want to make sure that our listeners know how to access, find out more information about the Ombudsman Program or how to volunteer. Can you just repeat that information of where they can find out that information?
Sure. If they can go to our website, and again, it's www.ltcombudsman.ny.gov. And then click on Who's My Ombudsman, or they can call our toll-free line, which is 1-855-582-6769.
And I will also put this, when I put the link to this show on our website and our social media pages, I'll also put these the website and the phone number as well. But it just really seems like such a great program. And as we're leaving, I just want you to leave us with something. What is some of the rewards of being a volunteer? Because you really sort of inspired me to become more involved with a lot of things like this. What are some of the rewards for a volunteer?
Well, I think there's many rewards, but like I said, most people seem to be connected personally. At least that's the start of connecting to Ombudsman, but really they're touching so many lives in a vulnerable population, as we mentioned, and they make a difference to so many people and even families. And so many of the residents really don't have anybody else looking out for them. And so it's such an important role for so many people that are vulnerable and alone. And just an additional quick program note, we are having a volunteer training in May. And so if anyone's interested in trying to get into the program sooner than later, definitely give me a call. The local program number is 518-372-5667. And we are planning on hosting a training in September as well.
Great. Well, thanks again for being our guest today, and we hope you'll come back at some point in the future and tell us how things continue to go.
Great.
That'd be great. Thank you.
No, thank you for sharing this information about this program.
So you've been listening to the Social Workers Live Radio Talk Show with our special interview with Catherine Horan and Mark Miller from the New York State Long-Term Care Ombudsman Program, sponsored by the New York State Office for the Aging. Thanks for listening to the Social Workers. One more quick announcement here from Alyssa.
I just want to say our last show for the semester will be on Tuesday, May 3rd. We'll have, it's Cystic Fibrosis Awareness Month in May, so we'll be having a mom and advocate of cystic fibrosis, Nina Dardachi, coming on to talk about how the diagnosis of her daughter led her to become an advocate, the supports needed for families who have children with medical issues, and how we can all help in finding a cure for cystic fibrosis. So that will be Tuesday, May 3rd, our last show for the season. So please be sure to tune in.
And Alyssa, can you give our listeners one more time a reminder about where they can find out information about the Social Workers Talk Show?
We have our website. If you go on the albany.edu/SSW, there's a link to our page, The Social Workers. We also have a YouTube channel, which you can find us. We're The Social Workers, a Facebook page, and a Twitter account. So definitely find us. All our past shows are located on YouTube with links and promos for our next shows on social media. So you can always access one of our shows in case you missed it. We have various topics, and our shows go back for a few years. So there's always something that you can tune into.
Great. Thanks again for listening to the Social Workers. You're listening to WCDB Albany.